Mr. Chairman, I want to thank you for holding today's markup on H.R. 1854, the Comprehensive Justice and Mental Health Act. I ask unanimous consent to enter into the record letters of support from the Major County Sheriff's Association, the National Association of Counties, the National Association of Police Organizations, the Police Foundation, and a coalition letter representing more than 100 groups nationwide.
Without objection, they will be made part of the record.
Thank you, Mr. Chairman. Mr. Chairman, this bill has broad bipartisan support and has over 75 co-sponsors, including several from this committee, and companion legislation passed the Senate by unanimous consent last month. I would like to take just an opportunity also to thank a couple of members, especially the gentleman from Florida, Mr. Nugent, and also my friend from across the aisle, Bobby Scott, who have both been leaders in this initiative in the past Congress, and we want to encourage them in this one as well. Across the country, an estimated 2 million mentally ill individuals are booked into jails each year. Many jails hold more people with psychiatric illnesses than the county's psychiatric facilities. It doesn't make sense to use our criminal justice system as a mental health system. It doesn't help mentally ill individuals who would benefit more from treatment and supervision, and it doesn't save taxpayer money. It doesn't make communities or law enforcement any safer. If someone is mentally ill or suffering trauma, too often our first instinct is to treat them with fear, and that's not right. It's time we do better. H.R. 1854 does that in a common sense and conservative way. H.R. 1854 reauthorizes and improves the Mental Ill Offender Treatment and Crime Reduction Act. It provides for continued support for mental health courts and authorizes investments in veterans treatment courts. I have visited these types of courts back home in Northeast Georgia, and I have seen what a difference they can make. The bill includes a new grant accountability measures and emphasizes the use of evidence-based practices to better protect taxpayer dollars. H.R. 1854 also recognizes that state and local solutions are usually more effective than federal one-size-fits-all approaches, so it enables those on the ground to implement practices that work best for their neighborhoods and communities. The bill also provides grants for diversion planning initiatives, which have been shown to reduce jail and prison costs and expedite case processing. In fiscal year 2015, Athens-Clarke County, which is partially located in my district, received a grant for this important purpose. These programs have a clear track record. One study shows that the corrections-based treatment programs can reduce an individual's risk of recidivism by 25 to 50%. A study done in New York City found that post-booking jail diversion, there resulted in a net savings of over $6,000 per person. In DeKalb County, Georgia, in 2014, those who went through a mental health court program had a 71% retention rate. Nationally, participants in mental health court programs spent fewer days in jail and were found less likely to incur new charges. My home in Northeast Georgia and the state of Georgia as a whole have been leaders in these efforts. In Southwest Georgia, the Daugherty Superior Court Mental Health and Substance Abuse Division was selected as one of just 4 peer-to-peer learning sites nationwide under the program. These sites are chosen to share their experience and expertise with agencies across the country so that others can learn from and build upon their successes. We need to encourage more work like that is being done in Georgia, and this bill provides tools to help make that happen and expand on the accomplishments back home. But importantly, this bill also lowers the program's current authorization level to more accurately reflect historic appropriations levels to ensure finite taxpayer resources are being wisely used. This bill is not a magic pill to fix the system, but it will improve access to mental health services to people who come in contact with the criminal justice system, and it will give law enforcement better tools to identify and respond to needs in the community. This bill is a step towards doing better. I urge my colleagues to join in support of this legislation, and Mr. Chairman, I yield back.